Dr. Anna Caroli. Dr. Caroli has a background in mathematics and a nearly 20-year-long clinical track record in medical imaging. She leads the medical imaging laboratory of the Mario Negri Institute of Pharmacological Research in Italy, with a focus on kidney imaging. And she's been strongly involved in European efforts aimed at boosting the use of renal biomarkers to improve the management of kidney disease in patients. And she's been the past chair of the International Renal MRI Network, joining up all renal MRI stakeholders. Since 2021, she's been coordinating the International RESPECT project focused on renal MRI standardization. And today she'll be talking to us about this work. And the title of her talk is Renal MRI Initiatives Committed to Open Science, RenalMRI.org, and Respect. The floor is yours, Anna. Take it away.
Thank you very much, Brandon, and thank you very much, Peter, for also organizing this session. Apologize for my low voice. Unfortunately, this is the situation today, so I hope you can still hear me. So in this talk, I will talk you about the renal MRI initiatives I've been involved in, especially this RenalMRI.org, that is a community effort that we talk you about, and the RESPECT project I'm leading now. Sorry, I cannot move it on. Just a second. Sorry, let me just share again. Okay. No, again. Okay. First of all, some background about renal MRI and what's the challenge here. So we saw that renal MRI biomarkers have high potential as enrichment and outcome biomarkers because they are non-invasive and sensitive. However, they are underused because they need dedicated expertise in MRI acquisition and processing. And I think this is quite similar to every other field of MRI. So transfer of solutions among centers is challenging, and this often leads to duplication of effort and increasing cost. There is a lack of standardization, and I'm sure this is not the only field again, and this leads to difficulties in comparing results and limits commercial exploitation, and also hinders the setup of multi-center trials and the ultimate translation into clinical practice. So in our case, similar to what also David has shown with Xenon MRI, we were a small group around 10 years ago, and we first met in Bordeaux, France in 2015, and we thought that it could be useful to create a sort of community and start progressing together. And from that time on, we increased in number, and we met regularly every 2 years. And you can see from the picture that we grew in number, and we are now more than 200 people working in this field. So in the Bordeaux meeting, we were just a group, so an informal group. We had the chance to work together in a European networking effort that was called Parenchyma for 4 years until 2021. And then from that time on, we have built this renal MRI community, which is a bottom-up member-led network that provides a space where everyone working in renal MRI can join. And I also take the chance to say that this is an open community, and membership is free. So if any of you is interested in working and is working in renal MRI, is welcome to join. So coming to open access and open access resources. So we when we became a real community, and we created this renalmri.org membership and status, we developed this website where we store a number of different resources. So this is just an example of what we had there. So we have books, we have a study document repository, we have software reviews, but I will go through this one by one. So let's start from the publications. So as a network, we developed a couple of books, so trying to explore and touch every single aspect of the renal MRI technique. So from acquisition to processing, and also focusing on the different sequences. So we had first a preclinical MRI book, and more recently, we also published an advanced clinical MRI of the kidney. And this was, again, a community effort, since the different chapters were prepared by the different experts of the community, and the result was, I would say, a real milestone for the community itself. Then we also had a number of reviews. First, a series of systematic reviews and statement papers of the individual sequences. And then also a position paper prepared by a number of nephrologists that also try to involve not only the more technical community as we were, but also the clinical community. So trying to have on board also clinicians. And finally, we also had 2 special issues that again also had the scope to raise awareness about the topic. And as part of these publications, we also had a set of technical recommendations for clinical translation of renal MRI. We had a consensus project, and we developed a sort of consensus process, and we followed this for each individual sequence. So we defined a panel of experts for each sequence, and we proceeded in parallel. So we published, as you can see, most of them in the same issue of the same journal. And again, this was another big achievement from the network that defined some recommendations and some standards to be used from that time on. On the website, we also have some open access toolbox, and this is one developed by our UK colleagues. And we expect this set of open access resources to be expanding over the years, because we also created a sort of synergy with different societies. So the community is based in Europe, so you can see that some of them are European, but over the time we also expanded beyond Europe, and we also reached US and also the other continents. So currently we are collaborating with the ESOR functional renal MRI, having a functional renal MRI working group, and also with ISMRM, where we created a new renal MRI study group. And we are also in strong relationship with the UK Renal Imaging Network. As a part of the resources, we also have a list of studies that have been performed or are currently ongoing on the topic. And we think that this is also quite important, because whenever you want to start a trial or a study, you can see what's going on in the rest of the world, or Europe, let's say, at least. And we also have a study document repository where we store some study documents that could be useful for the others to develop their own protocols. And among these studies, we have this RESPECT project that I am coordinating, that originates from the Renal MRI.org network, and as you can see, involves several centers around Europe, and builds on the parenchyma MRI standardization efforts. It also builds on previous UK efforts where they developed a standardized multi-parametric protocol aimed at extending them to a pan-European level. Okay, so here just to summarize the main objectives of our RESPECT project. So the first one is to harmonize and technically validate a standardized physiological relevant multi-parametric renal MRI protocol. So what we want to do is to improve renal MRI biomarker reproducibility. We also want to develop an open source platform for renal MRI processing and data exchange, and this to overcome the limited availability of renal MRI biomarkers. We are also working on AI tools to advance renal MRI processing. And again, in view of an open access policy, we want to develop guidelines targeting responsible cross-national MRI data sharing to ensure best exploitation of existing resources. We want to provide patient perspective on data sharing and the use of AI in clinical data processing, and also to provide some preliminary multinational evidence of cross-site feasibility and clinical utility. And this to set up the basis for future definitive multi-center clinical studies. So we started with a preliminary harmonization using phantoms. So the idea here was to harmonize the protocol across centers, across vendors, as you can see, but also across field strengths. So these are the two phantoms that we were using. So they are NIST phantoms developed by Caliber MRI, and we followed the NIST standard protocols. We acquired T1, T2, and DWI sequences. And so in terms of protocols, we are acquiring T1 on both T1 and T2 spheres using an inversion recovery sequence. T2 on 2 spheres using a multi-echo spin-echo sequence. And for DWI, we are acquiring 4 different repeated acquisitions per acquisition plane using an EPI sequence. And we are also assessing the phantom temperature using an SPGR sequence. And all these are acquired twice to assess reproducibility. So here are also some details about the processing. So we used 4-parameter fit for T1. We used a mono exponential fit for T2, mono exponential fit for ADC as well. And we wanted to assess the bias and accuracy error. So comparing the measured versus the reference values, vendor-specific reproducibility, and also inter-platform agreement. And here I don't want to enter in the details of the results, so this is out of the scope of this presentation, but just to give you a flavor of what we have done. So this is for T1, so we have found excellent correlation with NIST values. We see, and this is also interesting, so our range, so we have a quite large range of T1 as well as T2 and ADC values, but we also wanted to focus more on the renal physiological relevant range. That is what is here in shadowed in orange. So we can see that for low values, we have a higher bias, but this is out of the physiological range. So that's not so so bad, I would say. And this situation is similar for T2 here, and also for ADC, as you will see later. So again, for T2 we have a correlation, really good correlation with reference values. We can see that for 1.5 Tesla, we have a quite higher bias for low values, but that is decreasing in the physiological range. And we see also a difference between vendors, and that's also interesting. For ADC, we see a really excellent correlation with the NIST values. We see an asymmetrical bias distribution, and we see a similar bias distribution also on 1.5T and 3T. But again, in the physiological range, the bias is really, really low. Okay, so here we can see the reproducibility. So we have a near zero bias for both 1.5 Tesla and 3 Tesla. We can see again some outliers here, but the situation is satisfying, I would say. And the same for the other two parameters. Okay, here for the intersite agreement, we also measured this, and we saw again that if we consider the physiological range, the situation is much better than if we consider the whole range. And this is the case for all 3 parameters that we measured. Then the next step was to go to in vivo data. So in this case, we planned a study on 4 sites with 2 vendors. We decided to stick on 3 Tesla machines in this case. We have 80 healthy volunteers and 60 CKD patients, so 20 per center, except for 1 center that just enrolls volunteers. And we used the standardized renal MRI protocol developed in the context of the UK effort, so Ukraine MAPS effort. And this is quite a comprehensive protocol, including anatomical sequences, but also DWI, BOLD, ESL, T1, T2, magnetization transfer, and Dixon. And here what we want to assess is repeatability and reproducibility, as well as acceptability and feasibility in patients as secondary objectives. And again, here are just a few examples of the results, and these are just preliminary results because the study is still ongoing. But it's still good to have these because they show that results are promising, and so it's good, and we expect to have similar results also on the whole cohort. So this is for DWI. And we saw, so the numbers are not, as you can see, not high, but still 28 healthy volunteers for reproducibility and 20 for repeatability. In this case, we can see a difference among the parameters, and this is also in line with what we have seen before. So for D star and F, so the 3 parameters that we obtain using the IV model. So for D star, we have really good results. So almost 0 average bias for all of them, but lower limits of agreement for D star and ADC. And the same we saw also for ASL and then also for T1, T2. So also without entering in the details of these results, let's come to the take-home messages. So what we have learned from this experience, first as a network and then also in our RESPECT project, is that standardization is a community effort, and open access is key to make standardization effective. So clinical MRI protocol validation is a needy step and should be performed first in phantom and then in humans, so in healthy volunteers and patients. And this to ensure reliability of multi-center studies and ultimately to foster the translation of MRI biomarkers to clinics. And the proposed harmonized multi-parametric MRI protocol shows promise for multi-center and multi-vendor renal studies. So I want to thank all colleagues and all groups involved in this work. Thank you very much for the attention. And if you have any question, please.